This is the Sunday Mannin line, and I'm Roger Watterson. With me is David Ashford, who's the Health and Social Care Minister. And as I said just before the break, he's here to talk to you. And to do so, you can telephone us on 66 13 68. Texts and emails also, but telephone calls would be preferred. I have one here. This is an email, I think, David. It says, if the Minister doesn't believe the health budget is necessarily inadequate and the main problem is communication, why do you support a Treasury review of health?
Well, what I said is I've got no evidence at the moment that the budget is inadequate. And that's the very important thing, because the whole point of the review is we are going to be looking at the way we deliver services and whether or not the budget is inadequate. The review may well come back and say, actually, you're one of the most efficient services out there. You need another 20 million. That's the possible outcome of the review. Yeah, we don't know until the review takes place. But certainly, I don't think at the moment we have the data to say that the budget is inadequate. It would be very easy for me as Minister to turn around and say, oh yes, we need more taxpayers' money ploughed into the system. But I personally don't feel that is the answer. We may as well just have a bonfire of money if we're going to do that. We need to fix the system and actually check that the system we are delivering is the most efficient for the money that we've got.
Yeah, indeed. Now, Roger, surely MARS means mutually agreed retirement scheme, not redundancy. If it's redundancy, this would mean that the post is not going to be filled by a younger, cheaper worker. Or is this the case? A redundant post?
Well, the actual wording is resignation scheme. The R is for resignation. But in relation to that, most of the posts are gone. If someone goes on Mars, those posts are merged in, or if the post does stay, it's a radically different post to what was there before.
Okay, so there's no particular plan then to
so it's not a case
fill
of
the seat.
Yeah, it's not a case of backfilling with cheaper workers.
Okay, right. Okay, first caller's on the line now, and it's George. Good afternoon, George.
Good afternoon to you, David.
Hello, George.
Hiya. We have spoken. You may remember me at Waverley Court.
I do.
Right. Why? And can you tell us why so many people have to go away to have treatment, and how much does it cost?
I mean, the cost of treatment away is quite substantial,
I know.
And of course, it differs. I mean, it differs by what people require. And one of the things that I want to see looked at as part of this review is, are we sending away people that could be treated on island? The department is already looking at this, and one of the things I said in Tynwald last month was that the results coming out of that review may well say at the moment we're sending people away for things that are best done on island and can be done perfectly all right and correctly on island. Equally, there may be certain treatments that we're currently doing on island where it's more cost effective and better for the patient for them to be treated in a specialist hospital in the UK. So I think the review will be a bit of a mix and match in that area, but it's definitely something the department has got under its radar at the moment.
Well, I'll tell you what, I mean, I've been away twice to do different things since last August, and it's just amazing the number of people. I was amazed the number of people that go away. And we're talking we haven't got money, and they've got this harebrained scheme coming up now, £80 million for a birth. If they've got plenty of money to spare, they should spend it on bringing top men in to do operations here, because we've got a wonderful hospital here.
We have indeed, George, and one of the things...
the nurses, and I couldn't speak too highly of them because my wife's been in quite a lot.
We've got a wonderful dedicated staff throughout the health service, and one of the things I'm very keen on is, and unfortunately people are probably sick of hearing me bang on about it now, is telemedicine. And I don't think we do enough of that at the moment. One of the things I'm keen on seeing is where people at the moment are travelling over to see consultants. If it's just a conversation with a consultant rather than a procedure or where they need to actually examine you, there is no reason we shouldn't be using technology where people can communicate with the consultant via video link. And that's something I want to see progressed very rapidly over here.
Well, the first time I went away, they didn't even have anything from me. I had no paperwork. They couldn't find me on any of the things. it's just lack of communication between here and the hospitals away. You go away and they don't know what you're there for.
I mean, one of the key things that I'd say about that is with the digitisation now of the medical records, that should disappear, because I know one of the issues, and certainly as a constituency MHK, I had this issue with several constituents, has been the transfer of what were patient records, because we couldn't transfer things digitally to the consultants in the UK. That should now be disappearing with the digital strategy and the fact we have got a proper digitisation programme in place.
Well, I hope they ditch that and spend some money on homes for people here and to bring top men in to do proper operations. Anyway, thanks for that, David.
Thank you very much, George.
Thank you, George.
Let somebody else have a go.
Cheers. Bye-bye.
Bye.
Well, we have 2 calls in the queue at the moment, and we have a little bit of a problem in contacting them. But if you just hang on, folks, or ring back in a couple of minutes, we'll be with you. Now, what else have we got? We've got quite a few texts and emails in here, David. Staff on the busy frontline services within the hospital don't get time to log on and read emails or the communications. Staff should be able to access emails from home. Agency doctors and nurses from across are using it in AA during race periods, plus local bank staff. Also, permanent staff don't take annual leave over their race periods.
Yeah, one of the things that I think is very important is that when I'm talking about communication, I'm actually in many cases talking about face-to-face communication. In the digital age now, where emails flood in, I think all of us probably now look at our email inboxes, and it's very easy to send an email. You get hundreds in a day and things get lost. When I talk about communication, a lot of the time I'm talking about what you probably now term old-fashioned communication, of people actually sitting down and talking to one another.
Each other, yes. Right, good. The health service should benefit from all employees paying the full amount of NI contributions, not the 1% that now happens if you're paid 41,000 or more.
Yes, this is something that, of course, came in the UK in the 1980s, which is the upper level of NI. Again, I don't see the NI fund as being the thing that's going to save the problems and the budgets within the health service. I think, again, it comes back to, and again, people are going to be sick of hearing me saying it, that it's important that we ensure that we spend the money we've got efficiently before we go out and ask for more. The UK has tried over the years, during the Blair Brown years in the UK, there were billions pumped into the health service over and above inflation. What have they got out of it? Absolutely nothing.
It went from 4% to 7%, didn't it?
It did, and there's been billions pumped in, and they've not got any results out of that, really. And the system, if you don't have a system that is efficient, it will just eat money.
Right, our next call is coming up on the line now, and it's Stephen. Good afternoon to you, Stephen.
Good afternoon, Roger, and good afternoon, Minister.
Good afternoon, Stephen.
I was very pleased to hear you talking in the earlier programme about you're not in support of the wholesale privatisation of the NHS, and we haven't got that to worry about. But I just wondered what you thought about... I've got 2 points. The second one will come. The first point is that the review that seems to be led by the Treasury rather than healthcare. I wondered, could there be a situation where you would be at loggerheads with the Treasury if this review comes over strictly on money? And could there be a move to try and privatise some of the services that you may not want to do? So that was the first question.
Just on that
one. Deal with that one first, then.
Yeah, just on that one, Stephen, can I just clarify, it's not a review being primarily led by Treasury. The Department of Health and Social Care has been fully involved. Myself as Minister and Minister Cannon have been working jointly together on this review. So I know there's a few of my colleagues that have been positioning it as this is Treasury, it's all about the funding, and it's Treasury led. It's not, it's jointly led by both Treasury and the Department of Health and Social Care. I have engaged with the Treasury Minister all along. I can more than happy to say I'm happy with what's being proposed as the review. We don't know what the result of the review is. As I said in the earlier programme, it may well come back and say you're underfunded and you need another 20 million. You're the most efficient service going and you're underfunded. We don't know. But one of the things I want to say as well about the privatisation bit that I mentioned earlier in the programme, I have not heard any of my colleagues, and it is scaremongering because I've not heard any of my colleagues in Tynwald saying they want to privatise the NHS. Nobody is saying that. What they've been saying, and quite rightly so, is as part of the review we need to look at the services that are being delivered, and are they being delivered in an effective way, or is there a better way of delivering those services for the people of the Isle of Man? Now, people tend to then interpret that as being, oh, that could be privatising everything. But to my mind, I have not heard that from any of my colleagues.
Well, that's very, very reassuring for me to hear, and I'm sure it's very reassuring for the listeners as well, David. So thank you for that. The second point I'd just like your opinion on, really, is, and it comes down to the historical building opposite the castle. And I just wondered, is the Council of Ministers being too businesslike in saying they offered it to MNH for the price that's been settled upon? And would a better way forward have been to offer it to MNH for a peppercorn rent on a full repairing lease? And then that would have saved the MNH a big chunk of money out of their budget, and it would have kept the building, or will keep the building if this is adopted, for the people of the island and the tourist. And is this going to be a repetition of the unfortunate way that Ramsey Courthouse was disposed of, which upset and annoyed a lot of the public? So I just wondered, would that be a better way forward, and what's your views on that?
In relation to the police station in Castletown, obviously I've heard the debate that's been going on the last couple of days. I think it is important that government does get value for money for its assets. I think that one of the key things, though, about this that makes it very, very different to Ramsey Courthouse is it is on the registered buildings register. It's number 24 on the register, and it's been registered since 1984. And part of that registration states that it prohibits the alteration or demolition of the structural appearance of any part of the building. So whoever buys it has to comply with the registered building rules and regulations. So it's not a case of someone could buy this and then just do what they like to it and trash it effectively. They can't. So I think those rules and regulations are in place, and I think it is important that government gets value for money. The building is no longer required. Manx National Heritage, I saw what they were saying about they didn't want to step into their reserves, but surely that's what the reserves are there for instances like this, where they want to maintain things. But also M&H is, of course, applying to be an interested party, so that in any cases where planning comes forward, where someone wants to do it, they will be involved with whoever the new owners are.
Isn't this a case of not joined up government again? They're all working in little boxes, little compartments. I mean, the property's owned by government. M&H is effectively a part of government services.
No, I don't think it is. I mean, the government spoke to M&H, so that's not a silo mentality. A silo mentality.
What I meant is expecting them to pay for it.
Well, no, I mean, I think, if you're going to do something, you've got to get value for money, and the Department of Home Affairs...
It's just pouring from one jug to the other, though.
Well, it's slightly different, though. Don't forget, M&H isn't like a government department. M&H is a separate organisation. It is a charitable organisation.
Should we be effectively flogging off the family silver, though?
Well, to be perfectly honest, Roger, government has no use for it. One of the processes that goes through when these buildings are looked at is they are offered round other government departments. So one government department will speak to the other departments and say, I've got this building here, we no longer have a use for it, do you? And in the instance of this particular case of Castletown Police Station, the other government departments didn't have a use for it. Now, again, I should emphasise it is on the registered buildings log. It does have prohibitions on it in terms of what can be done with the structure. Manx National Heritage would be an interested party, so can speak to the new owners, whoever they may be. So I think it is a very different situation to what happened with Ramsey Courthouse.
Okay. All right, Stephen, I've got to move on now. Does that keep you happy?
I'm afraid not, no. I think planning, and everybody you talk to around the island has no faith in the planning system to protect heritage buildings. And just a quick example I'll give is government have kept the former police station in, is it Port Erin, I think, which seems to serve no useful purpose. And I think we've got to remember that government is more than just a business. It's doing what the public need and want, and sometimes a business case simply doesn't stack up, and that should be done for the right reasons. And I'm afraid on that issue we'll have to disagree, David.
Okay. Well, thank you for joining us, Dave.
Thank you very much, Stephen.
Bye-bye. Right, now, another call in a second or two, but I've got one. According to the report, a flu jab costs the NHS £8, according to Margaret, she says. And why can't you purchase them cheaper? This would be worth checking out.
Yeah, from what I can gather, Roger, from what you were quoting earlier, it came from a Freedom of Information request.
Yes.
And from what I can gather, it's referring to a particular type of vaccine. So it's not referring to all flu vaccines. It's a particular specialist type, the Immuvac vaccine. And I think it's also the Immuvac vaccine, off the top of my head, that was dealing with one particular instance, which is swine flu. So it's not the general flu vaccination that people receive. That is about £5 a go.
So when you go to the doctors and they say, you're pretty geriatric, you should have a flu jab, that's not
costing you £4,000 a go. I should clarify that.
Okay.
It is a particular type of vaccine it was referring to, where there was 5 doses that were required.
Okay. Right, now we have another caller on the line now, and it's Charles. Hello, Charles.
Hello, Roger. Hello, David.
Hello, Charles.
As you know, my health for the last 2 years has been very poor. But I would like to put on the record the absolute excellent service I have received from everybody in Noble's Hospital. There's no messing about. I mean, because of the morphine I have to take, it lowers my breathing, lowers my oxygen, and even with forced oxygen, I have to sometimes get rushed up there, and 3 consultants working on you straight away. And like the other week, I went in to see Tracy Vanderplank for my eye check. She said, something not quite right there. So she said, I'm going to give you an urgent referral to Mr. Khan. Got that at 9 o'clock next morning. Got a phone call, come and see Mr. Khan, 9 o'clock, went and seen him. He had a look and he said, right, I'm going to make an urgent referral to Broad Green, and I've got that for a week on Monday. Now, I don't see how anything can beat that. I mean, the service that we get is brilliant. The only negative, I would say, David, is that government need to get, maybe yourself, to explain triage, that while you're sitting in that waiting room with a broken finger and nobody's moving, the feed is coming in at the other side by ambulance, and some people could have heart attacks. Now, if you explain to people how triage works, they would then probably understand it a lot better. So that's that point. First-class service. 10 out of 10, David, for coming on social media to put facts. I think that's brilliant. I think it's an excellent what you do. But also, what I'd like to say is that when we are being prescribed medication, and I know this for a fact, that the machine that the chemist uses to produce the label has a facility to put the cost on. And if I would really like to see the cost of medication there, because that would then bring us to our senses. It would give you more care of the medication, I believe. I mean, when I heard of £4,000, I thought, well, I'm not going to have one next year, because I don't believe £4,000 just to avoid me getting flu is that important. But obviously you clarified that. But yes, I really think it's that apparently it only needs to click a switch or whatever button, and it puts the cost on. And I think people would then probably, appreciate the medication more. But I would really like to say that, from your coming on to social media and that you really seem to be the man for the job. And I'm a lot more confident with you there. And I really wish you well and would support you all the way, mate.
Oh, thank you very much, Charles. Can I start by saying I'm delighted that you've had such fabulous treatment. We have a lot of dedicated, hard-working staff all around the department, and I'm sure they've been delighted to hear you come on and thank them for their work. In relation to the flu vaccine, just to emphasise again, the figure Roger was giving was in relation to a particular type of vaccine, not the general vaccine, which is a lot cheaper and is about £5 a go. So I do need to emphasise that again, but I'm delighted that you've had such a good experience with the system, and like I say, we are very, very lucky to have such dedicated and hard-working staff.
I tell you what,
Okay.
right from all the way through. I mean, I can be finicky, but there was not one member of staff who was lax or lazy or anything else. They were very focused, did the job, polite, courtesy, etc. I just think we have the best Nobles hospital. As far as the patients are concerned, I don't know. I've seen the flow charts of directors and managers above that, but that's an issue for you to sort out. But I just, people are so quick to knock Nobles, but I just couldn't knock it at all. It's been a lifesaver, and okay, I'm still housebound, but I know that if something goes wrong, I'll be attended to straight away.
Well, Charles, thank you for your contribution to today's programme.
No problem.
Thank you.
Thank you,
Cheers.
Charles.
Bye-bye.
Bye.
Right. Now, there's one or two texts and emails. Quite a lot of them just come in here now, David. So we'll take a break in a minute. But let me, actually, Mr. Ashford mentions prescribing of aspirin and paracetamol and the associated cost. I have paracetamol prescribed as it's the only painkiller I can take. I'm more than willing to buy my own, but no matter where you get them, you're limited to a maximum purchase of 32 tablets at a time. You could go from shop to shop and get as many as you require for medical purposes. However, this is not always easy to do if you're not very mobile. Maybe the authorities would allow people to buy more over the counter at your named pharmacy, and that would be a compromise.
I think in relation to aspirin and paracetamol, when I was talking in relation to that, what I was referring to is those who are being prescribed it for one-off things. There are obviously those that are on long-term aspirin and paracetamol for certain conditions and have to have it in higher volumes than you would normally expect. In those cases, I think there would still be a legitimate reason for prescribing it. I don't think, particularly those, because what I wouldn't want to see is the relaxation in general stores. The limit is there for a reason, and I think it's a very sensible limit to have in place.
Right. Somebody, it's the lovely Catherine. Well, aren't you being sexist or patronising? Come on, David, don't be so sad. That's not this David, it's another one. Communications is a very massive problem at our hospital, and I'm glad you're onto it too. Also, do you think we could use modern technology rather than sending people to the UK for a checkup, which is what you were talking about?
I've just been talking about
we could use
telemedicine.
Skype, and it would also save money. From Broken Davy, I'm not sure what his name means, but yeah. So, well, it's not just Skype, there's all sorts of other facilities.
There is, and as I was just referring to earlier, Roger, in relation to telemedicine, if we're sending people over and it's just for a consultant to do a face-to-face chat where they're not actually doing any examination, I think that's not a good use of our resources or the patient's time. If it's just a general chat with no examination, then we should be using modern technology to enable that to be done here on Ireland.
I appreciate you working on this. So I have had the experience of arriving at a Liverpool hospital and the fellow saying, "Well, what are you here for?" Almost because there's nothing available there. It hadn't arrived. I'd arrived, it hadn't.
Yeah, and like I say, the digitisation of patient records should correct that.
Would you please tell me how much you pay a doctor at Nobles who appears to only work on day a week, the rest of their time spent on private work?
Well, in relation to doctors, their pay is obviously relevant to the role that they do and the speciality and the level of what they're prescribing. So certainly I couldn't give you an exact figure for an individual doctor because it differs from doctor to doctor.
Right. The figure of 4,300 a dose for this vaccine, this flu vaccine, was reported in the Examiner dated the 28th of November as having been released by the department following a Freedom of Information request. At the time, I ignored it, assuming it was a misprint. Given this vaccine is correctly offered to hundreds, if not thousands, of residents, it would seem to be a hugely significant expense, millions of pounds a year. Appreciating that Mr Ashford is new to this ministerial role, would the permanent staff not have advised him concerning such a significant
Can I
expense?
say,
Well, we've dealt with
well,
that.
we've dealt with it, because as I just want to emphasise again, the vaccine that's being talked about is not the general flu vaccine that is received by hundreds of thousands of people. My understanding is this particular vaccine was in relation, it was the Imuvac in relation to swine flu, and it was 5 doses. It is not the general vaccine. The general flu vaccine comes in at around about £5-6.
Okay. Time for a break.
Your
You're listening to The Mannin Line, and our studio guest today is the Health and Social Care Minister, David Ashford. Well, David, we're getting quite a lot of texts and emails, not too many phone calls, but quite a lot of written contribution. So let's see if we can bat through these. We've got about 12 minutes in which to do it. Now, if a private medical care didn't exist on the island, the rich patients would make sure the system worked.
Well, I don't agree with that. I mean, I think the system does work. I think there's obviously challenges. There's challenges in private medical care as well that are similar to the challenges faced in the public NHS side. I think what's important is that we deliver a health service that's fit for purpose for everyone.
Now, Rob in Peel has sent one in, which is interesting, because he says waiting lists are a bleep bleep disgrace, as people who have had bad hips have to wait in severe pain for years to get a hip replacement. Scan waiting times are terrible, and sometimes they're waiting for 2 months for the results of a scan. A worrying time for a person concerned. Well, possibly. I have to say that I have not experienced any problems with scans. Maybe there's a prioritising of what the complaint is there?
I mean, obviously, in terms of waiting lists, there are certain waiting lists that are a concern. The department is aware of it, and we are looking to address it. I'll be brutally honest, and as I was in the main programme, and say that things don't change overnight, but I can assure people there are work streams underway, and we are aware of difficulties in certain areas.
How do you decide which treatment to fund? I mean, this famous phrase, clinical commissioning.
Well, I mean, this is why we have a clinical recommendations committee who looks at the various treatments. Obviously, myself as minister, I'm not going to try and claim I know it all about health. So the decisions are taken by professionals, and that's why we have the clinical recommendations committee to look at that.
But sometimes it used to be, wasn't it, that the Isle of Man side decided it wasn't going to fund something, but as you're working with the UK Hospital and Trust, and they do, you've had to go along with it.
Yeah, and what's important is that we work towards a system that's right for us. In the UK, they have got different pressures and different demands to what we have in certain areas, and I'm not a fan of just blindly following what the UK does. I think we don't particularly want to be necessarily going down the same route as the UK.
But if a patient is not signed off by the UK hospital, you have to go along with what they prescribe, don't you?
I mean, obviously there's certain restrictions around that, but I think we need to get a health and care system that's suitable for us and not keep looking across the water and saying they're doing this, so we should be.
This is a more catch-all question from Simon. He says perhaps the government should review the services provided by all government departments.
Well, in some ways, there's the SAVE programme, which I sit on, which is doing just that.
Right, OK. And why can't the Castletown police station be turned into a museum? Maybe a museum of policing in the Isle of Man through the ages.
Well, we don't know who is going to purchase the police station at the current time, and they may have thoughts around that. But as I said before, I think the key thing for me is that the building, and one of the things that differs it from Ramsey Courthouse, is it is on the protected building register, and there is prohibitions in place as to what can be done with that building.
Right, OK. Well, I have to say I have seen buildings which are on the list, and they're registered buildings, and then because the person doesn't want them as they are, they're allowed to fall into disrepair, and then they're knocked down on safety grounds. That's happened a few times.
Well, it's important that doesn't happen, and as I've said, Manx National Heritage is looking for interested party status on that building, so I'm sure MNH will be keeping a close eye on anything that was to happen with that building.
Okay. Now, David, your namesake here, says you talk about proper communication and then proceed to mislead people about the cost of the flu jabs. until taken to task. Well, I don't know whether you misled them, but there's no doubt about it that the freedom of information request could have given a little more detail, couldn't it?
Well, I'm sure it could have done, to be honest. But as I've made absolutely clear, we're talking about a specific dose, so I'm not misleading anyone. I'll say that right now.
He didn't say
I've made it quite clear to people that we are referring to a specific type of vaccine, of which there was 5 doses.
Can you, the Minister, explain why we have social workers who commute home to England each weekend and they're provided with housing and have to cover for absences?
Well, I mean, if people have information like that, I don't necessarily believe every single. I wouldn't suggest to people they believe everything that they hear in relation to things like that. There is certain bank staff that we use in relation to across the department in different divisions that do commute backwards and forwards from the UK, who are filling in for vacancies. But I think what is important is that we try to recruit full time across the whole division. That's nurses, doctors, and social workers.
Juan Kelly says that he'd lived in a number of different countries and experienced many models of healthcare. Will your review look widely at other models or just at the variations of the UK Manx model?
As far as I'm concerned, the review is looking at the system that's best for us, and that means looking at all jurisdictions. It doesn't mean just being UK focused, and it shouldn't be just UK focused. As I just said a few minutes ago, I don't believe in us, just blindly following the UK. I think they've got their own problems, to put it mildly, with their system. So I certainly wouldn't be advocating that we become mini UK. We should be doing what's right for us.
I'm a lady, says this caller, a lady nearer 80 than 70, and I'd just like to pass on what wonderful treatment I've had at Nobles. I've had 3 operations in 1 year, and the nurses, doctors and surgeons were wonderful. We're so lucky to have a hospital like the one that we do.
I think we are very lucky, and we're also lucky that we have such hard-working and dedicated staff who go above and beyond to treat the patients that come across them. And I think that I just can't praise enough the hard work that does go in what can be a very stressful working environment.
I was looking at correspondence from the Right Honourable Jeremy Hunt, the UK Minister for Health, and he said he would love to implement the NHS Ubuntu protocol, although Microsoft, I think it says meant to be banned the use of their software for 10 years. Using NHS Ubuntu on even the most basic of computers would save our health departments tens of thousands a year. Would David Ashford please have a go on the NHS Ubuntu to see if it is advantageous to our local NHS?
Willing to look at anything. I think it's important that we do look at our IT systems and what we're delivering, and ensure that we have an efficient system, because at the end of the day, the whole point of an IT system is it's supposed to be there to help, not hinder.
I think David should go on to each ward and every member of staff on his own, without anyone from management with him. That way he would hear what the nurses think without feeling intimidated.
Well, one thing I would say is, if people do want to get in touch with me, and I will be going round on tours, I want to hear from people on the ground. I've said that from the day I became minister, and I mean it now. I am approachable. I certainly like to think I'm approachable, and certainly if people tell me things in confidence, that's exactly how it remains, in confidence.
There's been sometimes a fear of people, I don't know where the fear comes from, that if they did that, they'd be accused of whistleblowing.
Well, I think it's important that we have an open and honest culture in the department, and that people, if they've got concerns and they're legitimate concerns, feel they can come forward and express those. And certainly that's a culture I want to encourage.
Now, there's one here which I can't quite understand. If people not listening to the minister, how many times they have to explain the cost of bubble? Ramsey, I don't know exactly what that.
I'm
do,
not
do,
quite.
Do you understand that?
I don't quite
no,
get that.
I'm quite cotton on to that. After being in hospital recently, why is there a constant shortage of beds and people move from one ward to another?
I don't think it's necessarily a shortage of beds. It's about getting people in the right place. There are peaks and troughs throughout the year. There's peaks and troughs in people's health. This time of year, you do see a rise in demand of people being admitted. What is important is that we look at the way we discharge people. And I know that certainly the Director of Hospitals at the moment is very much focused on, are we being efficient in terms of the way that we admit people and the way that we then discharge them. And that is a work stream that is currently ongoing.
You can still close Ward 5?
At the moment, the proposals remain in place. and we're moving towards that.
So that's less beds.
At the moment, we're moving towards it.
Right. And the chemotherapy unit is moving into the main body still, is it then as well?
At the moment, that is the proposal in place.
Okay. At the moment. Yeah.
Well, I always keep every decision under review, Roger.
Okay. Right. Now, my daughter's a social worker and she's from the UK and goes home at the weekend, says this correspondent here. And this is now. Hi, I've been waiting over 12 months just to get one tooth out. I've paid all my NI and I think waiting lists are too long.
There is issues around dental treatment. I'm not going to sit here and deny that. I raised them as a backbencher in relation to the units of dental treatment available, and it is something that, again, the department is taking very seriously and looking at.
Well, I'm pleased to say, David, we managed to get through all the calls and texts and emails so far, unless one comes in the next second or two. So that leaves us really, I know, and we obviously see that you have a if you like, a mission. You're going to try and do all of this. But of course, we all know from long experience that it's very difficult within government systems to get anything done in a hurry.
Well, Roger, my point of view is I'd rather be ambitious and achieve half of it than not be ambitious and just leave things as they are. I think that we do need to be aiming to have a health system that is envious to other jurisdictions. And I think we have a huge opportunity to do that. It's not going to be easy. It's going to be a lot of hard work, but certainly as Minister, I want to be at the forefront out there pushing for that to be delivered.
Now, that's an interesting thing. You're at the front pushing. So, I mean, are you going to be like leading the troops from the front, or are you going to be behind shivvying them up? Because there's definitely got to have a culture change as well.
I think there needs to be leadership in the department, political leadership, and that's certainly what I will try to deliver. Some things I'm sure will be popular and other things won't be popular.
What's been the initial reaction so far to this?
I think that most people are buying into it. I think people realise that the system as it is does have to change, that there does have to be some transformation, and I think that most people I've spoken to have welcomed that. I think one of the reasons the NHS has survived, and we're now 70 years of the NHS, is because it has modernised, it has adapted over the years. That's one of the reasons it's survived so long.
Okay, now, we said at the start of the programme, you've got two responsibilities, social care as well. We certainly haven't had time to deal with that, so maybe we
more than happy to come back, Roger.
An open invitation whether we come back and deal with the other subjects at a future date.
Yeah.
Is that right?
And I think it is important that people do remember that it is the Department of Health and Social Care. I feel sometimes that social care is seen as the poor relation and people call it health, but I'm very much keen that it is joined up and it is health and social care.
I'll have to gallop through this, but you'll like this. The past summer we had a fantastic experience at the hospital in the Isle of Man. Service was quick and the doctors and nurses and staff were amazing. We're from Canada and the system's a lot like our own, but much quicker. Thank you, says Chris.
Oh, well, thank you, Chris.
Right. There we are. That's it. David Ashford, Health and Social Care Minister, thank you for being our guest on both Sunday Opinion and the Mannin Line today.
A pleasure. Thank you for having me, Roger.